Good morning and welcome to For the Health of It This Morning. I am Dr. Scott Phillips, owner of Lifestyle Chiropractic and Wellness Center in the Clock Tower building in Heber, and I'm excited to be here this morning. First snowy day of the year. Hopefully everyone out there is driving pretty safely. My tires did not slip too much. It's not too bad. This is what in Texas we would say everything would be closed for sure. We wouldn't be here. No one would be in school. This would be the mass panic. People wondering if the world was coming to an end. But here in Utah, this is just something easy. So hopefully everyone's just out there having a good time. My kids were out playing in it this morning as much as they could, trying to make snowballs and not doing a very good job at it. But hey, listen, snow is here, winter is here, but that's still okay because we can still have a good time here on the show. We want to welcome our guest this morning from the Heber Valley Hospital, or the Heber Valley Medical Center, I guess is a better thing to call it. Mr. Steve Morrow's here, and he is going to give us some ideas about what's going on over at the hospital. We're going to talk to him in 1 second, but Sean, you want to tell everyone hi just so they know that I actually have a guest on.
Oh, it's good to be here, Scott.
So let's go over a couple of events happening in our valley, and then we're going to jump right into what's happening over in our local friendly neighborhood medical center. Really health-wise, these kind of events, this is sort of when time, holidays and things like that, I'm having a hard time finding fun things, fun, healthy, active. There aren't a whole lot of races going on outside right now. So I'll just remind you of the Thursday food tasting over at Real Foods Market. And again, the meditation that's over at that Balance that starts at 5:30 tonight if you guys want to try out some meditation there. And I talked to the lady that runs it, and I'm hoping to get her on the show soon. Maybe instead of doing it over there on Thursday evenings, we'll get her to do it here one time, and everyone listening can just get a good meditation session in. I'll probably fall asleep, though, would be the problem. But there are a few things going on in the community I want to make you aware of. First of all, we've got our Wasatch Wrestling Banquet and Auction. This is a great event every year. A lot of people come out, and awesome items to go and auction out and support a good local cause. So that is going to be Monday the 24th of November. That is that Thanksgiving week. The reason I know that is because my fifth child is due Tuesday, November 25th. So maybe I'll take my wife there and have her, I'm trying to see if they've got anything real spicy that she can eat, maybe get some labor-induced. Anyway, there's nothing on the sign that promises inducing labor, though. I want to make sure that people know that. But 6 o'clock at the dinner, and then, of course, they always have their silent auction and also their live auction, which I think is my favorite part. Just come and listen to the auctioneer. It's kind of fun. Tickets for that, family of 6 can pay $40 for dinner, or if you just want to come and support it on your own, it's a $10 ticket. Again, we love our wrestlers here in town, and a great little event for them. Let's talk about the St. Lawrence Ski and Snowboard Sale. This is another one yearly that brings just tons of crowds. They've got a huge selection of skis, snowboards. It's at the Zermatt Resort. There is an address here, but I think most of you out there know where it is. Friday and Saturday, November 21st and 22nd. So that's not tomorrow and the next day. That will be the week after. 9 a.m. to 6 p.m. on Friday and 9 a.m. to 4 p.m. on Saturday. So make sure you go out there and support that. Again, it's by St. Lawrence, another really good nonprofit charity type organization to support. And then we'll talk about the high school putting on The King and I, which actually starts tomorrow, I believe. We've got a show on the 14th and the 15th, and it looks like on the 17th also, and then the 21st and the 22nd. So this weekend, next weekend, go out and support our high school kids. The King and I is a great show. I really enjoy it myself, and so hopefully, I'm sure they've done a great job over there. So those are kind of the events that I know of. I guess if there's some hospital things going on, then Sean can make us aware of those. But let's go ahead and jump in. I've got an article we're going to talk about, but we'll do that after Sean has to leave here about 1:45, and then I've got 15 more minutes to blab. So I've got a good article to talk about that. So don't go anywhere. Let's talk to Sean here for a little bit and see what he has to say. Sean Morrow, I was just asking him. He said he's from Orem. But I guess my first question, Sean, to you is just, right, hospital administration. What gets somebody excited to do something like that? What's your education background, and then what got you to Heber, I guess?
Yeah. Well, to do what I do, you have to have a master's in healthcare administration or a master's in business administration. And while I was in my master's program, I connected with a small hospital CEO and started using his hospital for a few case studies, and found out that, that was something I really had a passion for.
Sure.
My mom had cancer when I was a young man, and so watched her go in and out of hospitals for 5, 6, 7 years, and eventually pass away from that when I was 17. But that experience, being in and out of hospitals, visiting her, and also having actually Utah Valley Regional Medical Center's CEO was in our ward.
Oh, wow.
And so just seeing him and the difference that him and his staff could make for our family and my mom was something that stayed with me.
Sure. And so Heber, I mean, I know you've been here for how long with the job?
Been here for 2 years.
Okay.
I've worked at 7 different hospitals all over the country: Kentucky, Tennessee, Oklahoma. Was in Juneau, Alaska for 5 years.
Juneau,
Alaska.
So this kind of snow here, this is nothing.
This is nothing in terms of snow, but I'll tell you what, because we were on the ocean in Juneau, it does get a little bit colder here in Heber.
Oh, really?
But more sun.
More
here.
sun.
I'll
More
take the sun.
And you can actually sleep in the summertime instead of wondering why it's light all the time.
That's right. Yeah.
So you've been all over the country. You've been here a couple of years. A lot of changes with the hospital in the last few years. Is this kind of something that you've envisioned? Is this something that a direction that it's been going anyway that you've sort of been able to help facilitate, or tell me, take as much credit as you want?
Well, it's been a team effort. My job is to, come in, look at the hospital, and assess where we're at and where we need to be. That's my primary role, and then to help get us there.
Yeah.
So the timing, I think, is right. We have a community that's grown by leaps and bounds over the last 14 years. The hospital was built in 2000, and we now have a hospital and model that was set up to serve 15,000 people, trying to serve 28,000 people.
Sure.
So there's a lot we've put into sort of articulating a new vision, a new direction that we want to go.
Yeah, and I'll tell you, I mean, really, it seems like almost every weekend you guys are announcing some new thing you've been doing. Tell me some of the highlights, some of the things that you've really been excited to see come through and come to fruition.
Yeah, absolutely. I think it started with the dialysis center,
sure,
where we saw huge philanthropic support from the community, people laying their hearts out there on behalf of these patients who have had to travel so far for so long, and really affecting their quality of life. We raised, because of the community's generosity, around $920,000,
wow,
roughly, for that. Part of the big strategic movement that we've seen that came out of that was that we acquired the old Gene Brown building right next to the hospital, 38,000 square foot building. And as part of that acquisition, we were able to lay out some new strategies. We've built out the dialysis center inside of there. We've added outpatient physical therapy, which is now being offered. And we reopened the aquatics center inside of that facility. So we're doing a lot of health and wellness activities in there, water aerobics, several different classes coming online right now. We have a therapy pool in there with obviously our physical therapist providing oversight.
Right.
We have a lap swim available. We're going to be opening back up very soon the aerobics room for Pilates, yoga, those types of things.
Some classes, things like that.
Yeah, so that building acquisition opened up a world of opportunity. We were able to put in a specialty clinic into which we are recruiting a new general surgeon, which starts April 1st.
Wow.
We brought in an OBGYN, Dr. Chris Cook.
Yeah, we had Dr. Cook on the show. He was fantastic.
Yeah, people really, really like him. And I think one of the bigger strategies we have that's sort of flown under the radar screen because it's more internal to the hospital is we've looked at our medical model here. We have wonderful, wonderful family practice, family medicine physicians who have done amazing things for years.
Yep.
They deliver babies and do a great job at it. They've covered our emergency room as physicians for years and years. They do great things in the operating room and run their clinics. They're amazing people. But one of the challenges we have is our market's evolved, our community's grown, and we really felt like we needed to make the transition sort of from this generalist model, a physician that does a little bit of everything, to getting more specialists to complement those doctors. So Dr. Cook coming as an OBGYN, we're already seeing people are flocking to him. They love him. Having our own general surgeon in town rather than utilizing two that live in Park City, I think is going to be huge. We've transitioned our emergency department. We brought on Dr. Chris Kemp, who's a board-certified emergency medicine doc, as our medical director for that service.
Okay.
And by the end of 2015, about 50% of our shifts in that emergency department will be staffed with board-certified emergency medicine docs.
So we're opening up the emergency room for emergency physicians.
Right, which we've had great coverage again from the family medicine docs. They've done a great job, but I think we're being a little bit responsive to our community's needs given the population growth.
Well, we have to laugh every now and then. You kind of joke and say, here we are in this small town where these, family practitioners, again, I want to echo, I've met most of them. They're fantastic physicians. Really very capable. It's not like you're sacrificing anything by going to them for these types of services. But, you always kind of laugh. You come from different towns, and again, people are moving here from all over the place, and they're like, oh, so their family doctor does the baby delivering and the emergency medicine, and then he's going to go next door and help get a cow out, right? So you kind of just, but it's good to see, that we're moving along those lines of getting all these specialties.
Yeah, and those family medicine doctors are amazing people. They're so connected to the community. They've lived here for years. They know the people. They care about the people, and so as we go through this transition, we're trying to keep that component, and at the same time, sort of understanding our community is rural in some ways, not rural in others.
Right.
And so changing that medical model to meet expectations is important.
Yeah, I think, and if they can kind of come in and fit in much like Dr. Cook has, I can see it being very seamless. Really, I think he's come in and been welcomed with open arms, and everyone I've talked to has really, really enjoyed working with him. And so funny thing about his interview is obviously one of my big questions was, what's it like to come to a smaller town? And then he tells me that he was working at, in a town of 9,000 people. Yeah. And so I had to change that questioning around a little bit. And I almost wonder if that kind of adds to what he brings to this valley, sort of that he knows what it's like to be even in a smaller town. He probably saw some growth over there, and I think he's helping out in that way too.
Yeah, I think that makes a big difference. The people we recruit, one of the things we're really striving to do is make sure that they're a good fit with Heber Valley.
Sure.
That's so important. And so we've brought great people to the valley. They're great physicians, but beyond that, they're just great people.
Right.
And so we think we're really contributing to the valley.
Well, it's not hard to convince them to move here, I can imagine.
Yeah, great place to live, an absolutely wonderful place to live. Some of the other things we're doing that aren't necessarily bricks and mortar, not necessarily related to recruiting, is we've never lost our focus on patient satisfaction.
Sure.
Our nursing staff, respiratory therapists, imaging, lab techs, just done an amazing job. We've implemented best practices around patient satisfaction and our overall patient satisfaction on the inpatient sides, the 99th percentile.
Yeah.
So it's fun to see people bring their heart to work.
Right.
We talk a lot about the fact that we interact with people at sacred moments in their lives every day. And so we have to bring our heart, we have to bring compassion and love for every individual that walks through the doors.
Well, and I think a lot of people that have been there feel that, all these kind of different local social media sites. I don't know if you get on and peruse those every now and then. I know Amy Tuddenham does a good job of kind of being the voice of the hospital on some of those. But, I'll tell you, most people, when you ask for a recommendation for a doctor or for a hospital, it's becoming way more local, I think, than it's ever been. A lot of people would say, oh, go see this person in Orem, go see this even in Park City. But now we're getting this overwhelming kind of response of, hey, the Heber Hospital's where it's at. I'll tell you just our own personal experience, my wife and I, we've had 4 babies in actually, I guess, 3 different places, but we never really even considered the Heber Hospital for whatever reason. And just when we started to look at where we were going to have this 5th, there really was this overwhelming, you will love it there, people take care of you. And so that's where we decided to have this 5th, and we're really looking forward to it.
Well, I'm glad to hear that, and I think you'll have a wonderful experience. I've, again, worked at 7 hospitals. This is the only hospital I've ever worked at, and I've been the CEO of 4 or 5 of those, and It's the only one I've worked at where my letters commending the hospital are 10-1, against somebody with a complaint.
Somebody with some issue.
And the amazing thing to me was I had a letter that essentially said I had tons of anxiety before I came to the hospital. I was worried. I was concerned. I didn't quite know what was going to happen. She said when I walked through the doors, I had an overwhelming feeling of calm, and I knew that everything was going to be all right as I started interacting with your staff.
Wow. That's
never happened anywhere else I've been. I think we have something it's extremely unique at our hospital here.
Yeah. And I hope that anybody that maybe does have that kind of, somebody told them something about the hospital and they've never really been in to try it out. Hopefully, they're interested now to go and see again. Great changes, great things happening for sure. I asked on Facebook when I kind of announced that you would be on the show, I said, hey, throw out any comments, questions, anything like that you want to. And it's funny because most of the time people just kind of hit the like button, and we had quite a few people interested, I think, in what we're going to talk about today. But the one comment that I saw that I wanted to talk about for a second was that the cafeteria food was fantastic. This was somebody that said, and sometimes you think, Park City's got a really nice cafeteria, and they as far as lunches in Park City, that's one of the places to go because it's a little less expensive, tastes really good. But tell me about your cafeteria staff. Tell me why that would be the comment that someone would say, hey, I'm excited about the food in the cafeteria.
Yeah, hey, they do a great job. It's, they're able to put their heart into the food, and they have great sensitivity to the patient. So, if you come out and want to try the food, I highly recommend it. We have some great plans in the works. We've just finished master facility planning, which is essentially replanning our campus for the future, replanning the interior of the hospital. How do we grow with the community? Where are we going to expand, and when and why?
Sure.
And part of that plan is also changing the exterior look of the hospital, just updating it. But great plans for the cafeteria, bringing it back to the food. I think when we get done 4 or 5 years from now, we're going to be able to match the environment of where you eat in the hospital to the quality of the food we have right now and the quality of the people serving it.
Yeah, that'll be great. Let's talk about that south building, right? Isn't that what you're calling it these days?
Correct.
That's the old Fit Stop, which was then another gym, and now it's the south building for the medical center. I've been through the dialysis center. It's a wonderful place. I've been to the physical therapy office also. Again, anytime I say anything to Amy Tuddenham, she's like, hey, come over, I'll give you a tour.
Yeah.
Which I think it's not because I'm, some big radio celebrity. I'm sure it's just because it's probably not the red carpet treatment for anyone in particular. I'm sure if anyone's interested in going and checking it out, that she would do the same thing. Tell me about how we're filling it up, the usage of it. Are we supporting, and you can talk about them individually if you'd like. I know the physical therapy hasn't been open for too long, but tell me how community support is for those things.
It's been amazing. It really has. The outpatient physical therapy, we've started with one therapist, Katie Geyer. She was with the Russian ski team full-time.
She's been
for
on the
4
show
years.
too. I think she's fantastic. Great.
Yeah, so she's full. She's full. She's a full complement of patients. So
Great.
We're in the process of recruiting a PTA and a physical therapy assistant, and then another part-time physical therapist to work with her. Aquatic center's filling up consistently, slowly, but consistently. 2 or 3 new members per month.
Yeah.
We started that with lap swim, and then now we're adding water aerobics classes, fitness classes.
I don't mean to put you on the spot right now, but do you happen to know kind of time-wise? I know that's something we can look on the website and find out, but I knew about the lap swim. I know they've got some morning times and then some lunch times and even maybe an evening swim. But water aerobics I wasn't as sure about. Do you know when abouts that usually happens?
Yeah, I believe, if I'm correct, there's 2 sort of midday classes, 3 days per week.
Yeah.
And then we're adding 2. Those daytime classes are already online. People can call the aquatic center and sign up for those. And then we're bringing a couple of evening water aerobics classes online, I think, next month.
I know that's a really popular thing in this valley. I was, as we were talking about the bond for the new aquatic center and kind of getting a feel for what the community wanted as far as that type of thing. It was funny because a lot of us younger people were talking about, oh, this is going to put a big burden on the seniors, but it was very interesting to see a lot of these senior citizens come out and be say, look, we're not sitting on our porches. We're not, we want to get out and we want to be active also. And so I love that they have a place now that they can do that. I kind of had to laugh because if anybody goes to the Fit Stop on a regular basis, I mean, it's full of our active senior citizens. I think sometimes move here for this type of environment.
Yeah. Definitely have a very active lifestyle here, and that is really important that we're able to offer things that are health and wellness related. I know in the water aerobics class we'll have a silver sneakers class.
Yeah.
We'll have, if you're looking for a low impact exercise that still gives you a good workout,
right.
Water's great.
Oh, it's hilarious. The first time I ever sweated in the water. I thought that was such a strange thing.
Yes.
But it happens quickly.
Yeah. And we'll do some prenatal and postpartum water aerobics classes as well.
I think that's a great idea.
All kinds of subgroups. So people should call the Aquatic Center and see what's available right now and what's coming.
And Dialysis Center's been open for what? Has it been a year?
This coming April. It will have been a year, and it's doing great. We're right on line with the number of patients we thought we'd be serving. There's 7 being served right now, and then in addition to that, 2, 3, 4 vacationers that have been looking to vacation here,
but never really could because driving around is such a pain.
Just makes it difficult. So fun to get to be able to impact the tourism a little bit.
Well, and I know that specific service. I mean, when you have to do that 3 times a week, sometimes daily, it can be a really taxing type of thing. And now we see the snow on the ground. I get nervous still. I have to tell you a funny Texas snow story because obviously coming from Texas, this is something I never did, was drive in snow. Still kind of freaks me out here 5-6 years later. But that whole we moved in August. And we were like, hey, we should get our registration updated, all that kind of stuff. And I thought, you know what, I should keep these Texas plates on my car. And I will tell you that when I had those on my car, man, everybody stayed away. So I'm like, I need some winter Texas plates, because then just everyone looks at that plate and says, you know what, we're going to stay away. But, it's such a stressful thing to try to get someone down the canyon. So I went to that grand opening. It was a wonderful event, and I'm just glad to see that it's providing the impact that we thought it would, because I know that, it's just such a great thing to have in the community.
Yeah, it's wonderful, and we'll continue to grow and add, and as the patient population increases. So
now there are other businesses in that building that are not hospital affiliated. Tell me, are there? And not saying but you guys have room to expand in there still, don't you?
We do. There's about 3,000 square feet of unused space right now, so that gives us some room for other physician recruitment initiatives. There's couple of orthodontists, the Whitecap Institute, Lobrat, Dorius Dental, and then Dave Larson, a pediatrician, in that upper floor. And then we built out a specialty clinic up there, which houses Dr. Talbot, Dr. Hart, Dr. Adams, a couple of general surgeons, and pain management physicians. So
right.
Central Utah Clinic cardiologists will be in there soon as well.
And is that is that building where you're looking to do this kind of general surgery clinic that you're talking about?
Yes, we will. We'll likely have that general surgeon in the specialty clinic. They'll be there full time.
Nice.
The general surgeon's Dr. John O'Brien. He's had a lot in Red Ledges for the last 7 years, 6-7 years, and now he's finally building in the spring. Moving here from New Jersey. Just a great individual, tons of experience. He's been a general surgeon for 26 years, 27 years, and so he's seen just about everything.
Sure.
And just great individual with high quality outcomes and a breadth of knowledge we are fortunate to have coming to Heber.
So when you found out, hey, I've got the job here in Heber, I'm coming out, where were you at the time?
Well, that's an interesting story.
So I'm glad I asked.
I don't know
this
if you
question.
have time. But,
we got plenty of time.
But, I was the CEO at the hospital in Juneau, Alaska, and the management contract expired, and the complicated, but the city wanted me to become their employee.
Okay.
And yet I worked for the management company and had signed a non-compete with that management company. So could not do that without their permission. They didn't give it because they wanted to keep the management contract. So
Sure.
we ended up being out of work. So we waited a few months until the kids got out of school, sold our home, put all of our stuff in storage in Juneau, put everything we could fit in our car, and just traveled for the whole summer.
Awesome.
Yeah, got on the ferry, went up to Skagway and drove all the way down, and went over all the way to Washington, D.C., just doing sort of tourist things.
Driving.
Family driving.
Holy
and then drove all the way back to San Diego. But long story short, I've wanted to live in Heber Valley for 25 years.
Yeah.
It's been my dream location. I sort of thought that ship had sailed because I'd been at bigger hospitals, and I thought, well, I'm not quite sure.
Right.
Financially we can do that. So long story short, we needed a summer rolled around. I'd interviewed, been a runner-up at 3 or 4 other hospitals.
Yeah.
And we were staying in Park City for a week with some friends. And I said, I've got to drive down into Heber. I haven't driven down to Heber Valley for probably 5-6 years.
Yeah.
And so me and my wife got in the car. As we dropped down into Heber Valley, my wife said, we've got to enroll the kids in school somewhere while you keep going with your job search.
Yeah.
And she said, you've always wanted to live here. Let's do it.
Wow.
I was about 100 yards from All-Star Realty.
Yeah. Yeah.
I hung a quick right into their parking lot, seized the opportunity, went in, leased a condo over at the Zermatt.
Yeah.
And we finished the rest of our summer vacation, came back, lived at the Zermatt, got the kids enrolled in school. And after we lived here, the Heber Valley job came open.
Wow.
Unheard of in my industry. You don't move somewhere and then get the job.
I was going to say.
So we felt like
it's not like there's 72 hospital administrators in Heber.
Something else. I mean, to us, it was divine intervention. And,
sure.
And we feel like we were placed here.
So the job came available. You got hired. You came in, and tell me kind of what was your vision? What do you see? And maybe even still, I mean, it's only been 2 years. Obviously, I'm sure you were looking far into the future. When you came in, did you have a specific, hey, this is my mission statement? Was it more something that you adopted that was already going on there, or did it kind of hybrid a little bit?
Well, I've got to tell you that the culture of Intermountain Healthcare is amazing.
Yeah.
I don't think people in our state understand what we have.
Sure.
I've worked all across the country, and Intermountain Healthcare has always been used at the other hospitals I've worked at in Kentucky, Tennessee, Oklahoma, and Alaska as the standard.
Really?
And so now coming and working for Intermountain, I'm able to see that what I heard from the outside is true from the inside.
Yeah.
We have an organization that from its onset, and you have to look back at the origins of Intermountain Healthcare to understand this, but the LDS Church could have taken hundreds of millions of dollars. They had for-profit healthcare companies knocking on their door,
sure,
trying to buy these hospitals back in 1975, 76. They opted with great intention to not do that.
Yeah,
They formed a not-for-profit organization called Intermountain Healthcare. They asked a burning question of every board member, initial board member, and that question was, will you be committed to making this a model healthcare system that can be a shining light to the nation? And if they felt comfortable with the individual's response, they placed him on the board. Once the board was selected, the church walked away from the hospitals.
Yeah.
And so that's been the charge of this organization for 40 years, is make this a model healthcare system that can be a shining light to the nation.
Huh.
So I can tell you, walking in, the culture groundwork, the vision, the direction was set from the top of the organization all the way down to the newest employee. Having said that, here in Heber, the community has grown so fast, and the hospital, in my opinion, we had just lagged just a little bit in keeping pace with that growth.
Sure.
So all of this work that we're doing, the master facility planning, looking at how do we recruit additional physicians in here. We're trying to recruit an internal medicine physician right now because we don't have any. We've recruited the OB/GYN. We're recruiting our own general surgeon. We've recruited a whole bunch of board-certified emergency medicine physicians. We've upped our game in terms of patient satisfaction. There's nobody in the state that does better than we do at patient satisfaction, and that's inside of a premier organization.
Right.
So what we've done is just build on the strengths of Intermountain Healthcare. We'll continue to do that. We have tremendous focus inside of Intermountain Healthcare on making care more affordable. When we talk about a model healthcare system that can be a shining light to the nation, we're talking about one that will prevent healthcare from bankrupting this country.
Sure.
And that's what we're faced with if we don't initiate reform. And that's I love about Intermountain Healthcare. We're not sitting back on our haunches waiting for the government to dictate something to us. We are creating reform in a very proactive, don't really like that cliched term, but it is. It really is what's happening.
Yeah.
We're creating systems and structures and changing the incentive system so that we are making care more affordable.
Well, and I think that's
and that's a whole nother subject.
Well, and that's the name of the game, really. We had Mike Hewlett on, who's a kind of Obamacare, I should say Affordable Care Act, because that's the correct term. But he's studied the act for a long time, and he's now trying to help people kind of navigate through these somewhat unsettling and unsure type of waters. And I think what we're starting to see is a lot more people are being asked to pay for a lot more things that we usually just kind of thought, our copay will cover all these kinds of things. And so you're right. I mean, you don't want to make it a decision of, hey, I can't afford this test or this, imaging thing. I can't afford it, so I'm not going to go do it. And then if we don't go do it, then we might miss something. And then ultimately the person, so obviously, you could say, well, it's worth it. Mm-hmm. But man, if you can make it so that, it's almost a no-brainer, like, hey, yeah, this is affordable, I can go do it, it's going to be good for my health care, that kind of thing. I think that's definitely the way that things need to go. And so it's good to hear that that's kind of something that's important to you guys. Oh, yeah, it's huge. It underlies everything we do. And I look at Intermountain's legacy, and what they've done is they've proven out that you can increase quality, you can increase clinical outcomes, you can increase patient satisfaction, and as you do that, it actually reduces cost. Yeah. Because you're removing everything from the system that the patient does not value. You're removing everything from the system that does not impact in a positive way that patient's clinical outcome. Right. And there's a lot, unfortunately, that does still go on in medicine that is driven more by the fee-for-service system. Sure. Than a value, what's adding value to that patient outcome. Right. So, well, and I don't know. I think that's a pretty impactful statement that you made about Intermountain kind of being this beacon that, and I didn't know that. I was never a part of any hospital systems, and so I think for people to know that, I think it's huge. I think people should know that, hey, this is a hospital system that other people in the country look at and say, hey, this is how we should do it. And then I love the idea of Heber having one of the higher, ends of customer satisfaction. I mean, you look at it and say, hey, we're not a small town hospital here. This is the cream of the crop type of thing. It really is. And I think we're a secret. Yeah. Unfortunately, in the community sometimes. Our clinical outcomes, they match right up there with the top Intermountain facilities. Our patient satisfaction at the top, number 1 or 2 for the last 2 or 3 years. Yeah. So we are, unfortunately, a bit of a secret, so we hope people will come out and have the 2014 or 2015 Heber Valley Medical Center experience, rather than thinking back on their 1993. Yeah, exactly. 1990s experience. Well, and where healthcare, where medical care has come in that small amount of time. Anywhere you would think, hey, if I were in Park City in 1995, they didn't have the facilities they had. If I was in Orem that long ago, it's very different. I mean, everything's changed. And so I think you're right. I mean, as we see, and really, to be honest, going back to why I wanted to have a show like this in the first place, I really did want people to realize the quality of healthcare that they can get here in this area that's a mile from their door or 2 miles from their door, which 2 miles I know is a long way to go here in Heber. We moved 3 miles away, and we don't see hardly any of the people that we used to live by. We've got a different grocery store, all that kind of stuff. Mm-hmm. But I really love bringing people on here and kind of like you say, almost exposing these secrets and saying, holy cow, like, you're not going to get a better experience. You're not going to have better people. You're not going to have more certified doctors. I mean, people want to live here, including some of the top physicians, some of the top administrators, and so those are the people that we attract. And so, like you say, it's time to get into the 2014, 2015 mentality of go check it out and go see who's there and try to have that experience that you're looking for.
So true. What a great observation, Scott. The quality of people that are drawn here. We can't get the quality of people we have here in a metro area. We get people here who are leaving metro areas. They're leaving big medicine. They've seen just about every type of case and scenario they can, and they want to bring that experience to the quality of life that we have here.
Yeah, exactly. Even in the snow, I sometimes get a little nervous about my snow falling, but I'm like, there's cross country skiing, there's snowshoeing. Again, watching my kids just run outside this morning because they were so excited to get in the snow and play around in it. I mean, it's such a great place to be active, such a great place to be healthy. That's something that definitely attracted me. Was just the mindset of health in the community. And I want to kind of bring that over to your side of things. I'm sure this is something that you guys, again, you're putting in some of these health and wellness type of services. So tell me, do you see kind of on average with the patients that you interact with, would you say there's more of a value placed on their own type of, hey, I'm trying to get healthy type of healthcare here?
That's a critical piece. So there is more and more emphasis on that from the individual, more and more thinking about their health, and that's certainly an emphasis within our organization. Is we're trying to say, okay, we've got to change to reform healthcare, make it more affordable. We have to, yes, we have to change the incentive system for physicians. Yes, we have to change insurance products.
Right.
We have to take costs, non-value added costs out of hospitals. And the other component of that, which is really key, is individuals have to take accountability for their own health. Otherwise, the whole system falls apart. It continues to be expensive. 80% of healthcare costs do derive from 20% of the population.
Sure.
So how do we keep people healthy becomes very important.
Yeah. Well, and I think that education aspect, I've seen that you guys have held some classes, kind of patient education type of stuff. Is that something that you want to continue, something you're looking to expand? What's your idea with those?
We sure will be expanding those. So we have a wonderful dietitian, Betty Wade.
Yep.
She's been doing diabetes education for years in this community. She's certified to do that. I think the only certified dietitian on the Wasatch Back.
Really?
So she'll continue to do those and to expand on that. Cooking classes. How do you cook healthy?
Right.
That's pretty important. How do you buy groceries healthy? Youth diabetes intervention and support group classes. We do a nutritional class for the Wasatch High School athletes, one tailored to the boys, one tailored to the girls.
Really?
Yeah, because it's a big issue for these athletes.
Sure.
And we do CPR first aid training for all of the Wasatch High School coaches so that they're prepared and ready to intervene, keep people healthy. One of the reasons we started or tried to get and got the contract for the athletic trainer at the high school is because that's a prevention issue.
Sure.
Proper stretching, proper warm-ups, taping. When somebody is injured, making sure that that's assessed quickly and that they get to the right care quickly. So those are prevention and wellness initiatives. We'll do a lot more in the realm of education. We do a Step Express program with the 4th grade students. I think we're in 3 of the elementary schools in the Valley, which is focused completely on, it's a nutrition education module. So we're giving the kids some thinking, a chance to think about and develop some healthy life habits built around what they eat and their exercise. So we'll do a lot more of that in the future.
Good.
Part of the reason for that is again, we want to make care more affordable, and one of the ways you do that is you create insurance products that flip incentives upside down.
Yeah, sure.
And that's probably another topic for another time. We talk for 45 minutes on that. So.
Yeah, definitely. It's very interesting to see you guys getting out and getting involved in that manner. I think it's a huge step in the right direction. The CDC always talks about some of these top killers that we have year after year after year being lifestyle types of diseases, and diseases that could be changed with. And again, I don't think people are to heck with my health. I'm going to do whatever I want. I really think it is this education. It's these habits that we formed. even as early as 4th grade. I love that you're going into the elementary schools. I think that's a huge place to go to say, hey, the things that you do now, you talk about these athletes. I kind of have this passion and drive to make the old football injury, a thing of the past, because I see a lot of these people that said, oh, when I was in high school, I did this, I did that, I felt this pop or whatever, but I was 18, I was 17. You get up, you walk around, you walk it off, so to speak, and then 20 years later, when that cartilage is finally eroded, now I've got a problem.
The pain comes on.
And so I think it's an important thing. It's a big part of where healthcare can go. I think you're exactly right. It can drive down the healthcare costs if we can start to get that education out and say, hey, health is for you to have, and for us as healthcare providers to help you with, but ultimately that's got to be where it comes from, is you knowing and being equipped with the tools to say, this is how I can lead a healthier life.
Yeah, it's huge. It's huge. And so, even things like concussions with athletes. We started offering 2 years ago a free baseline assessment from a certified concussion-trained physician. And every high school athlete really should get one of these every 2 years. So if they do get a concussion, we can safely return them to the field, not too soon, but safely know when they've regained their cognitive abilities, and so they don't go back out and make it worse.
Well, and if you don't have that baseline, it's almost a guessing game at that point. And so I love that idea. I know we talked with Katie when she came on. She was talking about that. I think it's a fantastic thing. Sean, you talked our ears off for a couple of minutes here. I think it's about time to let you go. But anything else just burning that you need to say, or anything that Amy said, make sure you say?
Well, I do need to mention one of the most exciting things we have happening at the hospital that I haven't brought up is the fact that the orthopedic group, Rosenberg, Cooley, Metcalf, are coming back into Heber.
Really?
In the south building, we are building out a clinic for them.
Yeah.
They recruited a new orthopedic surgeon, Dr. Garrett Davis, who will be housed in that space 3 days a week. Dr. Patrick Olson, who subspecializes from elbow, wrist, and hand, he'll come over here a day a week, half a day of clinic, half a day of surgery. And then we're hoping, we're not 100% sure yet, but we would really like to see Dr. Charlie Lind, who specializes in knees, rotate back through here. So that's huge. I don't know if folks remember how big of a deal that was when that group was here for about 5 years, 2003, I think, to 2008. But what a boon that's going to be to our local economy and to our healthcare system.
Well, and talk about, tops in the world. These guys are, everybody comes from around everywhere to come out here.
They are. We've had some notable people that have come right here to Heber Valley Medical Center that could have gone anywhere in the world, and that orthopedic group was a big piece of that and why they came.
Well, fantastic. Again, great things happening. I had somebody comment on Facebook like, hey, I want to know everything that's going on. And then they said, but I don't have a radio. So luckily, the other thing, too, is this is going to be recorded, and we'll get a copy out there, and you can distribute it as much as you want and everything. But great conversation. Thanks for coming on and kind of telling us what's going on.
Thank you, Scott. It was my pleasure.
All right, Sean, have a great day. Enjoy the first snow, and don't slide around too much out there.
All right, I will do that.
You don't have to turn it off. I'll just turn you down. How about that? Good. All righty. So I'll tell you, it is interesting. When the conversation gets going, it doesn't stop. I can't believe it's already 1:45. But let's talk about this article that I found, and it actually really kind of segued nicely into what we were talking about. Sean talked about these initiatives, go to the elementary school kids and talk nutrition to them. And again, that's a passion of mine to get this education out there. And so let's talk a little bit about school lunches versus home brought lunch. And this was a great article that I just read on Yahoo Health, that a study has just come back. In fact, this was a let's see if I can find this. Anyway, a study just came back to say that compared to the lunches brought from home, that with the new school lunch initiatives that were implemented here at the beginning of 2013, now that we've looked at this, in fact, here it is. It was actually in Virginia Tech. So research happened at Virginia Tech, and they were looking at cafeteria lunches versus the lunches that people brought from home. And what they found is that cafeteria lunches are actually healthier than the meals parents are packing. just in general across the board, which is interesting. So what they did is they analyzed the contents of about 1,300 student lunches at 3 elementary schools in Virginia, and they actually came back and they said, hey, you know what, the lunches that we're serving in the schools are actually giving a little bit more nutrition, which I think is a step in the right direction. What we're looking at here is some of these changes. In fact, the interesting thing, the National School Lunch Program changed their guidelines actually for the 2012 to 2013 school year, so it started back in 2012. Updated its standards, requires to offer fruits and vegetables every single day. They've taken the refined whole grain carbohydrates and changed or shifted from the refined carbohydrates to the whole grain carbohydrates, and eliminated trans fat, which is fantastic, and then did a few other things. And so, and I'll tell you, I go to Heber Valley Elementary every Wednesday and eat lunch with my son, and I see this. I mean, I see that everybody's got fresh fruit or vegetables, something there on their plate. Most of the breads and things are whole grain. I think it's a really great step in the right direction. So basically what we found out is that the foods that the parents were putting into their brown bags had a few nutritional differences. They were less likely to contain fruits and vegetables, more likely to include chips and sugary drinks compared to the cafeteria meals. Again, it's so easy, right? They said, well, why are we having a hard time getting healthy foods in these lunches? Well, grab-and-go items, that's kind of in quotation marks, such as the mini bags of chips, Capri Sun, drink pouches, Lunchables. These were so easy. And then also, none of the school cafeterias in this area actually offered a dessert. And I would say, again, to Heber Valley's credit at least, and to the schools around here, they don't get dessert every day for sure. They do have some here and there, but I don't think it's every day. But 61% of the brown bag meals included some sort of dessert, almost like the parents think, hey, we've got to put a dessert in there because then at least they'll eat something, right? So what they said is it's a little bit harder to kind of plan these things, get the fruits and vegetables cut and ready to go, making sure the kids are going to eat it. This is a topic that we just finished talking about in my nutrition class up at UVU, and I actually had the students kind of put together a week's worth of healthy school lunches that obviously had to fit a bunch of criteria, and one of them is eatability, right? If you send your kid with all this healthy food that you're hoping he's going to eat, he's probably hoping he's just going to trade it for whatever Jimmy's got sitting next door to him. So let's talk about kind of these few essential things that this researcher said this is what we can kind of help with these lunches being brought from home, if that's something that you'd rather do than the school lunches. So number one was a source of protein. Again, if you just think of school lunch, bagged lunches, you think of a sandwich, you think of a bag of chips, and you think of a soda, right? I mean, that's kind of your staple thing. So what we have to do is, if you opt, for a traditional source of protein, like a sliced turkey breast or something that you put on a sandwich, she says, try serving it Lunchable style with whole grain crackers and other bite-sized nibbles. Just because some of these kids, instead of trying to down a whole sandwich, would rather just kind of put it on crackers and things like that. This is why Lunchables is so popular, guys. I mean, really, the kids love to kind of make their own little stackable sandwiches. It's kind of a fun thing for them, and this is something my wife and I have done for sure, is knowing that my son likes to do that kind of thing. Well, instead of getting in the Lunchable that has all the ingredients in there that you don't love, instead of doing that, well, let's make our own, right? And so we get good meats and we get cheese and we get good whole grain crackers, and he's got his own Lunchable, and he eats that just as good as he would any of the other ones. We've even got, let's see, here's a quote from her. She says, they might be intimidated by a big sandwich, and so other creative ways is tuna. You can put tuna in a can even and just eat it without being on a sandwich. Leftover chicken, grilled chicken from last night's dinner. And then she says thread fruit and little blocks of chicken and cheese on a kebab, which I think what kid wouldn't love. You can even put that on a little toothpick, and they would love to eat something like that. The essential number 2, she said, a fruit. And the easiest route is, she says, to toss just a whole piece of fruit into the lunchbox. But if you're worried that they won't eat it, then there's no use packing it, right? If it's just going to end up in the trash. So try to slice stuff up. Use a melon baller. I thought this was interesting. If you wanted to, any of the fruits, you can grab you a melon baller and make little balls of fruit that they can take care of. Sliced up strawberries, those types of things. And then another idea, keep that toothpick around and have them, put it in the toothpick and eat it that way. Dried fruit is an option, but obviously a lot of these dried fruit, they like to add sugar into it to make it a lot sweeter. Even those prepackaged fruit cups, those ones are soaked in juice, a lot of, syrup, sugar, that kind of thing. And so you want to look and see where your fruit's coming from. If they just won't eat the whole fruit, then but you can make your own fruit cup, you can make your own all this kind of stuff too. It takes a little bit more planning, obviously, but if you can do it, and I like the idea of having a toothpick there ready for them to eat, I think they'd like that. And hopefully that toothpick doesn't end up in their neighbor's ear or something like that, though. Teachers, be on the lookout for a bunch more toothpicks coming out. Essential number 3 is a vegetable. Now, this one is probably the least convenient food group to fulfill, right? We don't have veggie cups and things like that. But again, you want to prepare. And the nice thing about cutting up vegetables is you cut up a fruit 3 days before, and it can, obviously an apple, something like that, it can brown and it can get not to where you want it. So with the vegetables, you can cut up carrots, you can cut up celery, you can have that stuff ready to go and in bags long before you have to actually put them in the lunchbox. So you think, well, what if he doesn't like plain vegetables? Obviously, something that you can kind of dip in them, I think, is always a great idea. Ranch dressing is always your go-to, but I will tell you that kids won't just dip them in ranch dressing. And with some of the ingredients that are in that ranch dressing, it makes me a little more nervous. But I'll tell you, if you want another good source of protein, hummus, which is just ground up chickpeas, becomes a really, really good dip. Peanut butter, a good source of protein also. Almond butter, if you want to do, one of those different nut butters. But that's what I would do is either spread them on these vegetables or have it available there for them to dip. Again, it just kind of makes eating those vegetables a little bit easier. And I will tell you, if you're not doing these things at home, then there's no way they're going to eat them at school. And so one of the big things you want to do is start kind of introducing this type of stuff, at dinner time maybe, or at snack time, and say, hey, and start to realize what they do like to eat. And that's how you can know what they're going to eat at school. The essential number 4 is the whole grains. I think this is a really, really good idea to think about, right? It's very easy to throw in the saltine crackers. It's very easy to throw in the, the white breads and things like that. But those things turn to sugar so quickly that we're not just talking about nutrition here. We're talking about their focus after lunch, right? If you give them a huge sugar high and then don't expect them to crash, you're kind of kidding yourself. What'll happen is they'll be jittery all through recess, and by the time they get back into school and ready to learn, they will be out for the count. And so that's something that the whole grains can help with. They're slower burning, they're a little bit harder to break up, and so the body has to work a little bit harder and get a little bit more nutrition out of them. Again, you don't just have to have bread, right? There's whole wheat tortillas, and you can make your own little kind of tortilla crisp type things if you wanted to do that, or kind of thinking outside the box. Again, kids kind of love these newer things, these things they think that, my son loves to eat food that isn't a kid food. If you can make it look like, oh, this is something adults eat, this is something more attractive than just eating your own kid foods, quote unquote, then sometimes he really will try it just for that reason. So see what's out there, see what you like. Again, whole grains are a lot better. Read those ingredients. Make sure that when it says whole grains that you're not also getting some of these things. Look for the sweeteners and stuff like that. I will tell you, one of my favorite crackers out there is Triscuit, and she actually mentions that in here. But I'll tell you, look at those ingredients. I think it's whole wheat, and I think there's some salt and maybe some 2 other ingredients or something. And sugar is not one of them. So a really good cracker to check out if that's something your kid wants to eat. Now, essential number 5 was kind of looking at what you're putting in that is sweetened, and the biggest example in here was yogurt. And that kids, parents like to put yogurt in, and you think, oh, good, well, that's, yogurt's a fermented dairy, right? We're talking about some good probiotics, things like that. But the problem is a lot of these yogurts are super, super sweetened. And so look at those ingredients again, right? If sugar is one of your first ingredients, and then as you look down and you got even more sweeteners in there, then you're going to want to kind of look at it a little differently, because then you're sort of, the old adage that you're getting a little bit of yogurt with your sugar type of thing. The easier thing is to actually get the plain stuff and sweeten it on your own. Put some of your own, raw local honey in there, maybe some cut up fruit, that kind of a thing. And then you'll get all the good benefits of the yogurt without any of the nasty of their sweeteners. What I've noticed is when the grocery store, when the food companies actually sweeten the food for you, they're going to go above and beyond even what you would usually do. And so I always think it's good to get the plain stuff and then put your own sweetening into it. And I think with the yogurt, it's a good idea. Essential number 6 is a healthy source of fats, which I think is a really, really good thing to think about. I hope parents are starting to get out of this model that low fat is how we have to do things all the time, because really there are good sources of healthy fats out there that need to be eaten, need to be consumed, and the higher rate that we're consuming them, actually the healthier we're becoming. And so each lunch should have definitely some sort of healthy fat in it. Obviously, my superfood at that is an avocado, and I don't know what kid doesn't like avocado. Somehow you can cube it, you can salt it, you can slice it, you can make that a dip, right? What a fantastic dip for kids to have. Feel like they're, in a Mexican restaurant eating guacamole. You can just mash it up and put it in a Tupperware thing, and that's they can dip things in. But obviously, right, if you have some good raw nuts, almonds, cashews, those types of things, that's going to have some good fat in it also. You can kind of make your own trail mix, which could be kind of nice. You throw in some dried fruit, even a few little chocolate chips to give them some sweetness in there. But that's a really, really good way to get some good fat. Essential number 7 is water. Now, again, I've run into so many parents that think, oh, my kid would never drink water. They love to drink juice. They love to drink this and that. They don't drink the water. The issue is what do you choose? When given when given options, is the parent going for the water first also? And I think that's really, really important. Those are where all the studies show you can tell your kid how healthy things are and expect them to eat it, but unless you're actually patterning those same principles, you're just kind of talking. Right? If you're the one grabbing for the water when it's time to get a drink, if you're the one. And then the other thing I would say too is when that's the option, they're not just going to go thirsty. And so if you throw a bottle of water in there, even if there's something else to drink, right? If you like the 100% juice and that kind of a thing, it's not a terrible thing, especially when the juice boxes themselves aren't too big. But I'll tell you, you throw in a bottle of water there too, and invariably it will get drinking, whether it's right there during lunchtime, maybe later on they can come back to it for a snack. But you always want to have that water available. I think it changes so many things. Hydration, being hydrated and being dehydrated, change our health so much that we want to make sure these kids understand that every time they go to drink something, they should drink some water also. Whether they're going to drink something else too, it's not a big deal, but there should always be that water idea. And then the optional item here at the end of this article was the dessert. And this kind of what it says, if you want to send something, send a little something special, which I think that's kind of why parents do like the dessert aspect of it, right? You kind of want to give them a treat and say, hey, my wife always writes a little note in my son's lunch, and he loves that. But always there's that idea, what can we give them that's kind of a treat that they can be really excited about? So it says, skip the prepackaged sweets and make your own at home. And I think there's something so powerful to know what you're actually putting in your food, what you're actually baking, instead of those, oh, it comes in a little package and you have to open the package, and if you sat it out on the counter, it would still look the same in 6 months. Make your own homemade chocolate chip cookies, make your own homemade, even cakes and pies and things like that. When you make them yourself, you know what's going in there, and you know those ingredients, and you can also kind of sneak some stuff in there, right? And the lady that wrote this article, she said that, she'll throw in some wheat germ and some of these things, or we like to manipulate the ingredients anyway, and kind of exchange the white wheat for whole wheat, exchange some of the sugar for some other sweeteners, or even just decrease the total amount that it's asking for, and just kind of make these healthier type of desserts that the kid's going to be really, really excited about. But I do want to say you definitely don't have to have a dessert every single time. And if you get good fruit that they love, that can be looked on as a dessert, right? If you think about even a yogurt parfait type of an idea, you get your plain yogurt and you put some fruit in there, maybe a good source of granola, maybe has some nuts, you'll get some good fat out of that also. That can be dessert. And again, I can't stress enough, if you're not making this type of stuff at home, then yeah, you're just guessing, hey, will my son eat it if I take it to school? But this is the kind of thing you want to do. You want to experiment with it on the weekends. You're going to want to, have them help you make it, have them, figure out exactly what they like, what they want to eat. And I'll tell you, once they do that, then you send it to school with them, and they're just as excited as can be. So anyway, we are about out of time. Excited to have Thanksgiving here in a couple of weeks. Obviously, we won't have a show that morning. I know you'll miss it, but I just want everyone to be excited for the wintertime. I know that's a hard thing to do, but when it's newer like this, it's kind of a lot easier, and you say, hey, it's winter, we can enjoy this and go out and make a snowman when it's that snowy. And we'll look forward to having another guest on next week. And so we'll just sign off and say that even with snow out there, it's a good time to get healthy, a good time to go out and be healthy. If you do it for no other reason, then just do it for the health of it. Thank you for listening.